There's actually been really limited research into how this condition is experienced differently between men and women. We have some statistics to suggest that bipolar disorder type 1 is experienced equally in terms of prevalence between men and women, while bipolar disorder type 2 may be slightly more prevalent in women. There don't seem to be any differences between the type and duration of mood episodes for both men and women who live with bipolar disorder, regardless of the specific subtype. They seem to experience much more depressive episodes than hypomania or mania. However, one large research study looked at the types of medications and therapies prescribed to people with bipolar disorder and found that women were more likely than men to receive antidepressants and psychotherapy referrals, even when adjusting for the number and severity of depressive episodes. While it's not particularly clear what drove this difference, this finding may suggest that there are barriers for men with bipolar disorder to get help with depression specifically. Potentially, this isn't being picked up on or disclosed to healthcare providers. And when we look at men's mental health more broadly, there are lots of findings to suggest that there are these kinds of barriers for men to get this kind of support. And that's why the talk that we're having today and the resources that we'll be discussing are so important. Before we begin, I'll do some quick introductions and I'll run through some housekeeping before I hand over the mic to John and Marek to talk more about men's mental health. I'll introduce myself first. I'm a postdoctoral fellow at the University of British Columbia, and I'm studying digital health tools and quality of life for people with bipolar disorder. I've worked with the CREST.BD team since my PhD in 2015, and I joined the team in person in British Columbia in 2019. CREST.BD likes to practice what we preach in terms of talking about self-care and the importance of leisure. So as part of our introductions, we're not just going to talk about what we do for work, but also how we relax in our downtimes. Personally, lately I've been playing a lot of video games. I was hoping to spend a bit more of my spring and summer getting out and hiking and exploring beautiful Vancouver. However, the COVID restrictions are unsurprisingly getting in the way again, but I am getting my substitute hiking fix by exploring Hyrule in Breath of the Wild. So I'll pass the mic to John to introduce himself. We'd love to hear about what you do and your involvement in mental health research, as well as one thing you do to relax in your downtime.
Sure, thanks, Emma. My name is John Ogrodniczuk. I'm a professor of psychiatry here at UBC, and I'm also the director of the Psychotherapy Program. And as you mentioned, Emma, I founded HeadsUpGuys, which is a digital e-health resource for men with depression. And I like to do a lot of things outside of work. I like to be physically active. I love playing hockey, although COVID put a cramp on that. So I spend a lot of time riding my bike. I go swimming, putt around in my tiny garden. Anything that keeps me outside, I'm happy with.
Thank you. The garden behind you looks great as well. My plants haven't survived my absence from my office. Marek, I'd love you to introduce yourself.
Yeah, thanks, Emma. My name is Marek R. I'm an engineer in the environmental services industry. As Emma said, I have lived experience with bipolar disorder. I was diagnosed 18 years ago with type 1 bipolar with psychotic tendencies. About 4 years ago, I slipped into a pretty severe depressive episode that lasted about 2.5 years. But I'm now healthy, well, and living well with my diagnosis. I too enjoy the outdoors. In particular, I love to golf. I find it very meditative, and it's a great excuse to get outdoors for a few hours.
Thank you both. I'll just quickly note a few pointers about how this talk will run. So we have people joining us live in the Zoom and also watching on Facebook Live. If you have any questions through this talk, please pop them into the Zoom Q&A box or a Facebook comment or anonymously via the CREST.BD talkBD page, and we'll get to them after the main presentation. Any resources that we mentioned during the talk will be shared in a document in the Zoom, or that will be linked in the description of the presentation recording after it's completed. Otherwise, there's no more notes from me. So John, I would love to hear more about Heads Up Guys and how that started.
Sure, well, thanks. I'd love to tell you about it. We started Heads Up Guys now. It's going to be coming along 6 years this June. We launched in June 2015 during Men's Health Week. And what prompted us to establish this resource was recognizing that a lot of guys don't often end up asking for help when things are amiss. This is not just regarding mental health. It's regarding so many aspects in life, physical health. We all know the caricature of men never asking for directions, getting lost, and still never asking for directions. There's an element of truth for some guys in that it's very difficult to ask for any kind of help. And what often happens is that when guys are not feeling well, not reaching out for support, they'll often just suffer in silence and feel really constrained by that, isolated in their experience. Inevitably, things will continue along the path of becoming more difficult, more sort of entrenched, and it makes it even harder for guys to reach out because they feel like they've failed or haven't been able to be a real man and tough it out enough. So sadly for a lot of guys, they'll get to the point where the pain becomes so immense for them, they look to suicide as their only escape. And for a lot of guys, it's not that they want to die, they just want their pain to end. And so suicide is seen as the only option that they may have. Guys unfortunately account for a very large proportion of suicides in Canada, and frankly, most countries across the globe. In Canada, it's about 75% of suicide deaths are by men. And so we know what we're doing isn't quite working. We're not meeting the needs of men in the way that we can and should. So we said, well, let's try something different. We know from research that people will often turn to the internet to look for health information, try to diagnose things that they might be feeling that are wrong. And so we thought, well, let's try to meet them where they're at. Let's provide them with what they might be looking for with regard to their mental health, and specifically around depression and suicide. And the reason we focus on depression is because it's well documented that untreated or poorly treated depression is a significant risk factor for suicide. So addressing that is one of those upstream ways that we can potentially prevent suicide amongst guys. So there's still, and at the time that we developed Heads Up Guys, very, very little out there for men in the mental health space. So there's a big gap to fill. We're not going to fill it ourselves. We recognize that, but we said, well, this is a place where we could potentially do something. So we spent a lot of time and effort. It took us the better part of 2 years to develop our resource, doing a lot of research, doing surveys and focus groups, personal interviews with guys with lived experience, researchers, clinicians. So bringing in all these valuable perspectives and knowledge sources to develop what we've got today. And it's been going pretty well. So I'll leave it at that. I don't know how much detail you want. I can talk endlessly about it, but I know I shouldn't.
Thank you, John. That sounds great. Marek, I know you mentioned in your introduction that you've had lived experience of a pretty profound depressive episode. How much of what John's saying, rings true for your experience?
A lot of it. For a long time at the beginning of my episode, I was your classic case of suffering in silence and thinking that I could, quote unquote, handle it like a man. My depression was affecting my life in so many ways. it was affecting my relationships with my partner, my family, my friends, my work, my self-care, my day-to-day activities. But, despite the fact that I have had previously accepted and come to terms with my bipolar diagnosis, and even though I had gone through bouts of depression before, I found it really difficult to accept that I was depressed. I was in denial, and I really failed to see how much it was affecting my life. I didn't want to talk about it to anyone. I had feelings of guilt and shame, and there was sort of that vicious cycle that John referred to of feeling down and having negative self-doubt thoughts that would sort of spiral into worse feelings and worse emotions. So it was tough. It was really tough. I went for months and months without talking about it, and fortunately, I did start to talk about it.
Thank you for sharing that, Marek. That's it sounds like a really difficult period in your life, and I'm glad that you were able to reach out and find somebody to get some support from. I was wondering, we're doing this talk in the context of COVID-19. John, are there any particular ways that the pandemic is impacting men's mental health?
Yeah, we actually did a survey in the early days of the pandemic about a year ago this time, May, June. And we recently published the results. I can't remember them all, so if you see me looking down, it's because I'm looking at my list. One of the big things that we found is that 80%, so there's 434 guys that participated in this, all from Canada. And about 80% indicated that the pandemic has had a negative impact on their mental health. And I think that's a huge number, it's a very big number. And there's all sorts of potential speculations we can make about why that may be. I'll get into some of the findings that might illuminate some of those things. But, one of the big things are, especially in the early days of the pandemic, was the unknowns around what COVID is. What on earth is COVID? How do I catch it? Am I going to die from it? How is it transmitted? All this stuff. Can it be treated? And none of us knew. And it was really scary. And so a lot of people were harboring a lot of fear and anxiety around that. Then there's this cascade of consequences of the different measures put in place to mitigate the spread of the virus. So that really had a big impact on our social lives. It really took away a lot of opportunities that we had normally, then perhaps taken for granted, how much our work environments provided us with the social stimulation that we needed. So, a lot of people were no longer going into work and thus didn't have that environment to engage with others. But even other, recreational opportunities, so many things were shut down, and the things that we would normally do to give ourselves a sense of purpose and connection outside of work were taken away as well. So that had a massive impact, and thus you can imagine loneliness crept in for a lot of people, and that's this a really big kind of pandemic in and of itself, is how many people are experiencing loneliness and the impact it's having on our lives. Being contained within our homes, if there are challenging domestic issues at play, these can be compounded because it can feel like there's no escape from it. So there's lots of different factors that likely played into that. We had 42% of men who participated in the survey indicating suicidal ideation of some sort, which is really massive. And, it's interesting, 90%, almost 90% of guys indicated that they were complying with government social distancing implementations, measures put into place. And about 2/3 of those indicated that those had a negative impact on their mental health. I alluded to many of the things that likely played a role in that, and that's really by and large the social consequences of that. Financial stress was a big one. More than half indicated that financial stress was a big negative consequence of the pandemic. A quarter of them, the respondents, lost their job. Nearly another 20% indicated that there was reduced hours. So that had a really strong impact on people's lives. Um, 38% indicated that the pandemic had a negative impact on the relationship, and that manifested in various types of abuse. Verbal abuse was the primary type of abuse indicated as a perpetrator, but also as a victim. So there was about 31% indicated that they had perpetrated some form of partner abuse, but slightly more than a quarter also indicated that they themselves were victims. So you can see how the impact of the pandemic on one's relationship, their intimate relationship, really was quite profound. Also we found that people are spending much more time on the screen, even outside of work responsibilities. A large number were not exercising the way they used to, drinking more. And so you can see, many broad impacts on the lives of, it's not only men. Of course, our survey was about men, but I think all of us had felt in some ways being impacted in the ways that I described from the survey.
Yeah, and I can speak to a couple of those from a personal standpoint. You talked about exercise. I know that for me, going to the gym was a big part of my life. And, I just, at various stages of the pandemic, I just didn't feel comfortable going to the gym and being surrounded by people. And so I started to avoid that. And I'm sure that had a bit of a negative impact on my mental health. Obviously we talk about this social impact and the impact of not spending that time with your friends, with your family. We missed our regular Thanksgiving meal, our regular Christmas get together. Little things like that were pretty important and pretty big things to miss. And then I think mostly for me, I was a victim of COVID when it comes to job loss. We had a downsizing at our company, and I was one of the people who was let go, and that created a lot of anxiety for me and had a very big impact on me. I didn't slip into another episode of depression by any means, but there were questions of self-worth. There was a lot of self-doubt on my part that, why me, and why was I one of the ones that was chosen to be let go? And then the financial aspects of it as well were anxiety producing and stressful for me as well.
Yeah, you pointed out two big issues. It's not only just the economic impact of the job loss on ourselves when that happens. The more profound thing really is how it impacts our sense of self, because work gives us a sense of meaning and purpose. We don't want to be completely defined by our work, but hey, we spend multiple hours a day doing our work. It's inevitable. It's going to play a big part in shaping how we perceive ourselves. And so with the loss of a job, we're losing that purpose, that meaning, but also, like you said, you begin to question, why me? And it's very easy for those thoughts of self-doubt to creep into our mind and become entrenched, just as a way to try to, give some meaning to what happened. I lost my job. Well, I must not have been doing it very well. Okay, that makes sense.
Yeah.
Because, otherwise, if we feel convicted and it's like, I'm pretty damn good at what I'm doing, well, why did I get let go? So it's really hard to hold on to a strong sense of self in these challenging circumstances. So I'm glad that you were able to do that. Um, another finding I'm curious about, what you think about this, is that of the people who were able to hold on to their jobs, a lot of them transitioned to work from home. And, let me find it. We had more than half indicating that that had a really negative impact on their work-life balance. I don't know if you've had a similar kind of experience.
Yeah, actually, I think we talked about this before this event. I mentioned to you that prior to the pandemic, I had worked from home for a number of years, due to the nature of my job, and it does have an effect on work-life balance. You need to really make an effort to create boundaries between when your day ends and what the overlap is between your work life and your personal life. For me, I'm very fortunate that I have a dedicated workspace. I have an office in my home where I could close the door, and when the door was closed, that meant I was at work. And when I opened the door and left my office, I would try to put my work aside and try to put it behind me and switch to my personal life. But it's hard when you don't have that commute to differentiate work from personal life. And I would imagine, in circumstances where you don't have a dedicated workspace, for example, you're doing your work from your kitchen table. I would imagine it would be even harder to distinguish work from personal life.
Yeah, it's not only, you pointed out a couple things that are important. It's not only the dedicated workspace, which is really important, but it's also the rituals that we engage in around work. Like you said, hopping into the car and commuting to work is one of those rituals. What can we do at home to create rituals that put us in a place where I'm at work? I may be at my kitchen table or in a little office or whatever, but I'm at work and my mind needs to be there. And
Yeah.
those kind of rituals can help. And I think many people, I'll include myself, is that I feel like I've never been busier in my life, and it feels like I'm going in a million different directions. A funny anecdote: a couple of weeks ago, I was giving a presentation on work-life balance, and here I was on a Saturday afternoon doing this presentation, getting it prepared, as I was supposed to be going for a bike ride and picnic with my wife. And I thought, how ironic. I'm disrupting my work-life balance, which I usually pride myself on, so I can prepare this presentation on work-life balance, because I didn't get it done before. So even when we're mindful of it, it can creep in. So, we do have to be careful and hold ourselves accountable.
Very ironic. And
Yeah.
you talk about those rituals, and I think it can be simple things. If you're used to your commute, why not get up, get outside, go for a walk, even if it's just around the block. Maybe that is enough to sort of differentiate your workday from your evening or the rest of your day. I think those rituals can be something simple.
Yeah. And I often do that, something similar. Like at the end of a workday, I'll go for a walk or a bike ride, just because it's like I'm separating myself now from work. I'm doing something completely different, and it just helps with my own transition.
Sure.
Yeah.
Thanks, guys, for this really interesting back and forth about some of the ways to manage the increased stress and the very complicated circumstances of the pandemic. If a guy was watching this talk and thinking what Merrick has been saying about depression sounds, a little bit too close to home, what kinds of resources are contained in Heads Up Guys? What self-management strategies might you suggest to somebody who thinks that maybe this stress has perhaps tipped over into depression?
Yeah, we have a lot of great self-help strategies on the website. If you go to our practical tips section, you'll see them allocated into different life areas that are either impacted by depression or can impact your experience of depression. So, this is like sleep and diet, physical activity, social life, these kinds of things. Knowing that guys really like to try to figure things out on their own. So rather than trying to fight it or resist it, it's like, let's put the tools and knowledge and resources in their hands so that they can put healthy practices in place to help them on the path to recovery, but also live well. And so another element of that is the aspect of reaching out. And so I think it's really important to let guys know that reaching out for a hand doesn't mean failure. It doesn't mean you're weak. It doesn't mean that you're not good enough. Reaching out is an active part of you taking control of your life and doing what you need to do to get the resources in place to help you become better. And so it's not about giving up and say, I failed, fix me. It's like, what knowledge, what information, what guidance, support can you offer me that I can integrate into my life to live better? So I think that's really important. It's really exercising the agency rather than failure.
Yeah, I completely agree, John. You talk about taking control of the situation. And, for me, when I finally did open up about my depression, it was just that, and it was a huge weight off my shoulders. Obviously, it didn't cure me, but I felt a big wave of relief. And I really felt that it was the first step to my path to recovery. For me, it was simple. It started with opening up to one person. And for me, that person was my partner. From there, it sort of snowballed and had, positive effect over positive effect over positive effect. We worked on getting me the professional medical help that I really desperately needed. We took a look at how much it was affecting my performance at work, which it definitely was. And, again, that snowball effect, that negative self-doubt and that vicious cycle of, feeling worse because you're doing worse at work. Reaching out and talking to my medical professionals and talking to my wife, we made that necessary decision that I needed to take an absence from work. It also led to talking about my situation with my friends. I had been avoiding them, but opening up to them sort of, led them to understand a little bit of what I was going through, and sort of led them to trying to find ways that they could support me. And it was simple acts. It was, giving me a call, going for a walk with me, just giving me an ear to talk to, even, a shoulder to cry on. It's those little sort of acts of kindness and acts of support that are really important when you're in that situation. And it starts with something as simple as talking to one person about what you're going through.
Thank you both for sharing that. We have quite a few questions from the audience. So I think perhaps we'll move into that Q&A portion, and we'll probably get a lot more stuck into various self-management strategies and tools in the answering of those. So thank you. Our first question comes from somebody who is asking about supporting the men in their lives. So how do you support a man who's having a hard time but doesn't believe men can be mentally ill? My friend drinks a lot every night and has admitted he's been suicidal before, but believes men can't get depressed or be traumatized.
Yeah, that's a tough one. The first thing I'd want to know is how this fella kind of conceptualizes his drinking behavior, but also his thoughts of suicide. How does he make sense of it outside of the possibility of experiencing depression or a mental illness? So that would be a really critical first part. Um, we also need to understand and appreciate that for a lot of guys, admitting that you're struggling, admitting that you might have a health problem like depression or bipolar disorder, it can be really threatening to their sense of self as a strong, competent man. And so having someone bring that forth as a possibility can be really threatening. And it's like, no, I can't accept this as a possibility. It's wrong. We're not having this conversation. Some might even lash out and said, why would you even suggest that? Because it hits home too close. And so what you might only be able to do is just you bring it up. If they're not going to latch onto it and have that conversation, at least you've created an opening. If they are, for the future conversation, if they wish, but if they are willing to maybe think about things in a different way, rather than saying, well, you must be depressed if you're like this, rather than doing that, it's about, thinking or having a discussion about what their goals and objectives are for life, and then shaping change around working toward those goals. So if somebody wants to, be more physically fit, as an example, you can talk about how, the drinking can actually impair their performance in their sport or their physical activity, and then working around that as an example. Another thing that came to mind is that, this attitude that guys don't get depressed, guys don't suffer from mental health challenges. We know this is not true, but some guys latch on to this idea is that to be, a strong man, you need to be able to, handle life's up and downs, and you can be resilient, you can tough it out, you can be stoic, and everything will be fine. A resource like Heads Up Guys, puts those misperceptions and myths to rest. And it's like, look, a lot of guys experience this. This is actually pretty normal for guys to experience it. You don't have to feel isolated, alone, weak, or different because you might be experiencing it. And we've done different campaigns throughout the years around, guys with public profiles sharing their stories as a way. We've done a couple of campaigns with professional athletes sharing their stories of experiencing mental health challenges as a way to open the conversation, but also to reduce the stigma. And it's like, look, if I'm an NBA basketball player or whatever, and I can come out and talk about it, you can too, that kind of idea.
Yeah, my short answer to that would be, and this is something that I try to practice myself, is, speaking up and sharing about your own experiences and your own stories. If there's someone in your life, in your social network, that you think is struggling or having a hard time, a good way to approach the conversation is to say, look, I've had some of those experiences myself, and this is how I felt. And, I had a hard time too. And I started to talk about it with whoever it might be, and it really helped me. And, just sort of that, hearing that from a friend or from a family member or from someone close to you, that, you're not the only one. I think that has a big impact as well.
Thank you guys for sharing those sensitive tips to people who might be looking to support someone. And we're also going to be sharing a link to a website developed for people who support somebody with bipolar disorder in our document at the end of this chat for more tips for people who are in a caring or supporting role. In terms of another question, this person asks, how do you overcome comparing yourself to other more successful men that aren't held back by depression?
Yeah, that's a tough one. Social comparison is a huge issue. It's a really difficult thing to overcome because we feel like we're always having to meet some kind of metric for success in life because we view others and we have a selective filter. We often will filter out and select those for comparison, those that seem to be doing great. And that's the bar that we need to meet. And if we're not meeting it, we will get down on ourselves and it can be a very slippery slope. I would say, although when I'm saying it, I don't want to create the impression that it's easy, but focusing on ourselves so that we live our own lives. We have our own ideals of what happiness is for us, what my personal values and principles are for leading a good life, and really shaping it so it becomes very personal rather than what you think society wants of you or expects of you, as far as what success means, what happiness means. It's got to mean something to you personally. And so when you take that away, that comparison aspect, and it's like, be yourself and live your life. And that's going to provide you with a pathway toward working to a sense of happiness, joy, and contentment. That's what we really need to focus on.
Couldn't have said it better myself, John. Creating goals for yourself, for your unique situation, even if they're very small goals. I think that's a great way to build self-confidence, to sort of pick yourself up and move forward. Yeah, I couldn't agree more with what you said there.
Mm.
Thank you. It kind of sounds like some of the research that we did at CREST.BD found that as people spent more time talking to other people with bipolar disorder, they started to more positively reevaluate their circumstances. And I think that shows the value, John, with what you're doing with Heads Up Guys, having people talk about their own stories, as well as, obviously yourself, Merrick, coming on here and being open so that these kind of myths about, well, men can handle this don't persist once people are starting to bring it out into the light. I've got a question here about the kind of, I guess, physiological differences and how that might kind of play into men's mental health. So one viewer is asking, men's testosterone after 40 decreases by an estimate of 1% per year. Can this have any further implications for men's mental health, including men who have bipolar disorder, especially when loss of libido in men is a really depressing condition? So do you have any comments about the relationship between testosterone to mental health, John?
Yeah, I don't do research in this, nor is that part of my practice, but there is evidence to indicate that guys who suffer a significant depletion of testosterone, some of their symptoms can be depression-like, and that's where testosterone replacement therapy can be beneficial. But for those guys that aren't suffering from depletion of testosterone in a significant way, testosterone therapy is found not to be really all that effective. So it's really going to depend on the person and the circumstance with that hormone.
Thank you. And I know you also have some resources on the Heads Up Guys for managing that second part of the question, the kind of impact on sex and relationships that mental health can have.
Yeah, it's a big one. I think, as we all age, we need to appreciate that we change. Our bodies change, our minds change, and some of the changes aren't welcome, so as far as our, guys and sexual performance, it can be a tough one when, you know, your libido or sexual drive diminishes. It could be hard to get an erection or ejaculate. These are all, you know, natural changes that happen with guys as they age and our testosterone does decrease. But there's also aspects of how that impacts our relationship with our partner too, is that how we interpret those changes can be really detrimental. If we feel like that's representing a failure of us as a man of sorts, we're actually more likely to disengage from our partner, and thus, you know, not surprisingly, that can have a real negative impact on our relationship. But you can, you know, our relationships, we're always working, or we should be working on them, because those change too. Because, you know, maybe our sexual drive decreases, but it doesn't mean we can have close, intimate, romantic relationships with our partner where we derive a sense of, you know, intimate satisfaction that might be separate from the sexual aspect. You know, I know we don't have time to go into that, and that's not what this is about, but those are just some thoughts that come to mind about that question.
Thank you for sharing those resources. Marek, I don't know if there's anything you want to comment on that section, or I can ask another question.
You know, I think like a lot of things when it comes to symptoms of depression, you know, a decrease in libido is a very common symptom of depression. And again, you know, there's that sort of effect of a vicious cycle where you're feeling down on yourself, you're noticing that your libido is decreasing, and that, you know, sort of worsens your feelings. It gives you that sense of self-doubt and lowers your sense of self-worth. So there is that vicious cycle, like a lot of symptoms of depression create.
Yeah, it sounds like that the story and the interpretation that's based on these, a lot of the questions that we're having here is the really important part. We have a question about, so there's a few questions about the steps that you can take to actually find, to reach out and get help. We've had one viewer ask how they can find good psychotherapy. And I know that the HeadsUpGuys website has a little section on that, which we might link in the chat. But this connects to a question of how do you talk about your problems to a doctor without sounding weak? You know, when I tell my doctor that I'm more depressed than usual, I feel judged that I am drug seeking.
Yeah, that's a tough one. You know, I think the first part is that you have to give yourself some credit for opening up that conversation in the first place, talking to your doc, for example, about how you're feeling. And, you know, a lot of guys have immense difficulty around initiating that conversation. It's like, I want to talk to her or him about what's going on with me, but I don't even know how to start. And there's often embedded in there a fear of how they're going to be received and perceived by their family physician. What I tell guys is that whatever you have to say to your doc, they've heard it 1,000 times over. This is not going to be something new to them. And, you know, if you have the sense they're not being empathic, compassionate, receptive, you don't actually have to tolerate it. You know, the whole point of that relationship is a helping relationship, and the working relationship, the alliance between patient physician, just like in therapy between patient therapists, is so fundamental to making it work. So, you know, if you're just not connecting with the person, you're feeling they're not understanding you, you can talk to them explicitly about that. Or if it's just not going anywhere, look for another healthcare provider. But back to the aspect of feeling weak, I mentioned earlier about that sense of how you conceptualize it. You can feel weak or inadequate, or you can say, I'm actually taking the steps to take control of my health, do the things that I need to do. In a way, it's like, I don't give a shit what the physician has to think about this. I need their help for certain things. They have resources, knowledge, they're the gateway to other healthcare practitioners in the system. I just need them to provide me with what I need to move forward in this. And so it's really an active agentic aspect, sharing and revealing what might be going on, and keeping that mindset that you're the captain of your own ship.
Yeah, and I'll speak to the experience that someone specifically with bipolar disorder might have. Bipolar obviously is a cyclical, has a cyclical nature, and maybe not for everyone, but for the majority of people, slipping into depressive episodes is almost inevitable. The degree to which the depressive episode sinks, or the length of it, will obviously vary from episode to episode and from person to person. But knowing that you're susceptible to a depressive episode makes it all that much more important to building and maintaining your support team, and trying to do so while you're well. So, do that work of trying to find a doctor who you trust while you're well, and trying to get a referral to a psychiatrist or a psychotherapist while you're well. Having those difficult conversations with your friends and family members about what it's felt like in the past to be depressed, or the things that you fear about your next depressive episode. Those are hard conversations to have, but if they're a lot easier to have when you're doing well. And I sort of learned that the hard way. I didn't have my support network in place when I did slip into my depressive episode, and so I was at a disadvantage when trying to build my support network. I was very basically, I was completely out of it. I had no way of really speaking up for myself. I was reliant on my partner to try to set up appointments for me and to advocate for me at those appointments. So I think it's really important for people with bipolar to try to assemble your support team and have regular check-ins with your professionals to sort of try to catch things before they get too bad. If you can identify that you may be slipping into a depressive episode, and the same goes for hypomanic or manic episodes. If you can catch them as you're entering them, and not waiting until it's a full-blown episode, there's a much better chance of treating it and of getting back out of that episode before it gets too late.
Thank you. It's really good advice, Mark. Like any other health condition, it sounds like it's really important to take a kind of proactive approach and really use the resources that you have available. We have probably time for one more question. We've had a couple come in about anxiety, living with anxiety, which is for both men and women quite a common co-occurring condition when you are experiencing depression. So to both John and Marek, are there ways that anxiety look different in men, and any key tips for managing anxiety as a man?
You want to take that one, Mark? Or?
Sure, I can speak to my own experience. I suffer from generalized anxiety as well as my bipolar disorder. I know that it was much more severe during my depressive episode than it is while I'm well. In terms of trying to deal with it, you know, it's difficult for me. It's trying to find strategies that work. I really rely on my team, and I'll keep coming back to this whenever I have to. I really rely on my professional team. I rely on psychotherapy, talk therapy, you know, for severe anxiety or even generalized anxiety. You know, prescribed medication works well for me. You know, it's something that is difficult for me to live with. You know, unlike the depressive and hypomanic or manic episodes, it's something that affects me every day, and that's a lot more difficult for me to address and to manage.
Yeah, it's a tough one. You know, you mentioned medications that can play a very useful role, because if anxiety starts to take over, you feel very helpless. And, you know, that's
Yeah.
a core element of anxiety, is the sense of helplessness and fear about your environment and things happening, not being able to control things. So the medication can help, and to the point of sort of mitigating that you know, that generalized angst, if you will, but also make therapy more accessible, so you can learn the skills and strategies to better manage it as well. And you know, it's important to think about the different potential contributing factors to anxiety, because there can be many. You know, I mentioned the sense of helplessness, lack of control, but also a sense of constantly being evaluated, that you must perform to some extent in order to solicit the validation, support, and care that you really want and desire from others. And that if you don't meet the mark, so to speak, that will be taken away, and your sense of being inadequate just intensifies. And so there can be a lot of generalized anxiety around that as well. So it's important to try to get to the core of what might be feeding it. And that was just one example.
Thank you both for your comments about anxiety, both in terms of, again, Marek, the importance of using the support network that you have, and John, kind of tying back in how important it is to look about the myths that we have of, you know, self-sufficiency and identity, and what it means to manage your mental health. You know, that kind of sense of toughing it out, and how detrimental it can be to mental health in the long run. We had so many questions from the audience today, and I'm really sorry that we weren't able to get to them all. If we're going to run through some more resources, and I believe that a lot of the questions that we have were addressed in the various CREST.BD and HeadsUpGuys resources. And you can also take a look at the archive of our CREST.BD Reddit Ask Me Anything thread, where we also answered a lot of questions from the community about mental health and supporting a loved one with bipolar disorder. So hopefully, if your question if we didn't get around to it today, some of the resources that we cover will hopefully address that for you. But I want to give a big thank you to both our speakers for sharing your time and expertise on this, and really helping people out who addressing the clear importance of this topic and clear interest that the community has. So in terms of the paper that John was talking about earlier, we'll be sharing that in our resource package. if you're interested in learning more about how men's mental health was impacted by COVID-19. And of course, Heads Up Guys, which is the collection of resources and self-care strategies developed by John and the team, also has a specific section about managing your mental health during the COVID-19 pandemic. And there's also a section for friends and family on this website. If you're somebody watching who's wondering about ways to care for a man in your life, there are more resources contained there. We also have our CREST.BD Bipolar Wellness Center. So this has some great tips and resources for improving your quality of life across a range of areas, including, as Laura mentioned in chat, self-esteem, which is clearly a really important topic in terms of the role that identity and self-esteem plays in the depressive cycle in men's mental health. We also have the quality of life tool, which allows you to measure how you're doing across those areas. This can be really useful for checking in to see where you might need some extra support or self-management strategies that you can use to boost your quality of life across those areas. And it can also help you to test out the impact on your well-being of any of those things that you do try. We have our academic CREST.BD website, which is where you can stay in the loop about the research projects we're currently running, and you can sign up to our CREST Currents newsletter to hear about upcoming events, interesting studies, or research participation opportunities. As I mentioned earlier, we previously ran a Reddit Ask Me Anything thread for World Bipolar Day. And our CREST.BD blog has some of the most upvoted or endorsed questions from the community. And the answers from, we had over 28 experts and scientists and people with lived experience being involved for a 48-hour period answering questions from the community. So do have a look if you've got any outstanding questions, because we had a lot addressed there. All of our previous talkBD events are hosted on talkBD.live. We've been running this series for over a year now. We have lots of, you can watch the recordings of any of these, from substance use and sleep to coping with relationship issues during COVID-19. And we also have the Facebook streams are available for viewing. It's really important for us to get some feedback about how to improve these events, what you liked about it, what you didn't like about it, and any topics that you'd really like to see the CREST.BD team cover in future. So we'll also have a link to the survey in the toolkit that we'd love people to complete after the fact. And I also want to give a shout out to Caden and Laura, who have been managing the chat and the technical side of the stream, and also put together this resource kit to share with everyone. We'd like to thank our funders and partners, and we are formalizing our next talkBD speakers, but please do follow us on social media for updates. And we're also welcoming suggestions for topics to cover for the rest of the year. And if you'd like to stay up to date with our work or any of our partner organizations too, we'd also welcome a follow on our social media pages. So thank you everyone who attended, who asked questions, as well as our presenters, John and Marek, for their expertise. And until next time, stay healthy and well. Thank you.
Thanks. Bye-bye.
Bye.